Welcome to MD Insights. I'm Miguel Regueiro, Chair of Digestive Disease and Surgery Institute, and it's my absolute pleasure to have Dr. Matt Kroh with me today. Matt's the Vice Chair for Innovation and Technology in DDSI. And Matt, first of all, welcome back to Cleveland Clinic. We are so thrilled to have you here and also thrilled to have you on MD Insights.
Thanks, Miguel. It's a pleasure to be back in Cleveland and at the Cleveland Clinic here in Ohio, and thanks for letting me join you today. I'm looking forward to it.
So Matt, I want to talk a little bit about the future and vision of innovation and technology in digestive diseases. You've done a lot of personal work in this over the years, not only at Cleveland Clinic and at Abu Dhabi. You have a strong international presence. I think you really understand where the field is moving. So let's just start with a simple question about you, though. How did you get into your specialty? How did you kind of come about to be a surgeon and also to be an innovator in surgery?
Well, I think it was a chance opportunity in medical school for me to work with some pioneering laparoscopic surgeons, simply to set up animal teaching labs and to work with their research team. It wasn't my initial goal to be a surgeon, but after seeing the way they combine new technology, research, and education, it was really inspiring to me, and I consider them to be my mentors to this day. So that prompted me to seek a career in general surgery. I did my residency at Cleveland Clinic here in Ohio, and during the course of my residency, I also got to work with some outstanding mentors who were leading their fields in digestive surgery, integrating new techniques like laparoscopy, and innovating with the endoscope too. And I knew that laparoscopy and endoscopy were the cutting edge of minimally invasive procedures. I knew that's where I wanted to be. And Cleveland Clinic is a fantastic platform to deliver clinical care, but also research and education along those lines. So a lot of fortuitous opportunities that I hope I've made the most of.
Great. And so you mentioned the advances in surgical endoscopy, advanced endoscopy. I think more and more, and you've really shown this, and our colleagues here have shown that we can do more and more through a scope, whether it's a laparoscope, whether it's an endoscope. So tell me, Matt, I know you're newly back to main campus in Ohio, but what are your job responsibilities day in and day out? Kind of what's the bread and butter of what you do?
Sure. So in my new role as Vice Chair of Innovation and Technology, I'm going to look at a global view of innovation and technology in our institute and beyond. We have world-class caregivers that are already leading the charge in innovative areas. I want to work with them in all subspecialties, connect them to our innovation team, and hopefully bring new devices, ideas to Cleveland Clinic so we can give these services to our patients, delivering better care in a less invasive way. But beyond that, I don't want to look at device development alone or intellectual property development, new clinical service lines. That's critically important. It's important to our mission at Cleveland Clinic. But I want to extend technology and innovation to areas that maybe wasn't traditionally thought of, but will be important in the future. Areas like artificial intelligence, patient experience, access, telehealth, education, and global connectivity. I think Cleveland Clinic and DDSI in particular is set to be leaders in these areas. And I want to be a liaison to our faculty to make sure that we continue to innovate and lead in these areas.
Great. And I think as we look at the future, and so much is digital, and whether that's through devices, like you said, endoscopically, whether this is natural language processing, artificial intelligence, and I look forward to you leading the way for DDSI and really working with Cleveland Clinic in large. I want to ask a question now towards our physician audience out there who may be listening. What is it specific, if you were to describe to a physician, why should they refer to Cleveland Clinic, or what about Cleveland Clinic is special in the area of technology, surgical endoscopy, advanced endoscopy? How would you say that? What is it, the secret sauce, if you will, to us, to Cleveland Clinic, for the physician, and what should they know?
I think our secret sauce are our physicians and our caregivers. Our institute model allows that to progress in a multidisciplinary way, and a patient or a physician may not know specifically what he or she might need when they come. But when a team takes care of that patient, we can make sure that all the experts that are appropriate to see that patient can be there and participate in the best care delivery for that patient.
Great. So much of the secret sauce of innovation and technology is the bread and butter of just patient care, right? So access, communication, making sure we have the right team. So for the patients out there, when you think about technological advances in the future, specifically in digestive diseases, what are some of the highlights? What are future hopes for the patients, those that may have diseases or suffer from ailments? How would you look at innovation technology? What's the direct impact on a patient level?
Well, one of the cornerstones of Cleveland Clinic has always been innovation. We provide care for patients first, but in order to provide world-class, cutting-edge care, we have to be innovating at all times. So not just looking at the delivery of the best care today, but what will that care look like tomorrow? We're very fortunate to have world-class investigators and clinicians on this faculty who are engaged in the research that will change the way in which we treat patients in the future. So whether that's a new robotic operation that people recover from more quickly, or a complex procedure done with an endoscope that requires no incisions. These are the ways in which we're innovating. These are the ways in which we're bringing care to patients, and also are on the immediate and long-term horizons to help people get fantastic care and recover more quickly.
Great. And if you were to, as we kind of come to the end of our time, these MD Insights always go so quickly, but if you were to think about some of the highlights and maybe specific to whether it's surgical advancements, robotic advancements, what are some of the menu of things that we do here at Cleveland Clinic in these innovative fields, even today as physicians look to refer patients or patients look to come to us for their digestive disease care?
I think what we've seen is penetration of robotics into all forms of interventions, mainly surgical, but increasingly with endoscopy. And we're doing that today. But when you pair an advanced technology like robotics with artificial intelligence and deep learning, not only are we giving a less invasive way to approach a problem, but we can give immediate feedback to the proceduralist or surgeon doing that to make sure that the kind of operation and the way in which it's being done is consistent with the best care possible. So today we're doing robotics. In the not too distant future, that's going to be augmented with deep learning algorithms.
Great. So I think the future truly is bright. Innovation and technology are going to allow for better care of our patients, better diagnostics, better therapeutics. But also one aspect is quicker recoveries. I think that the patient tomorrow will have the ability to come in more and more almost in an outpatient or a short stay. I think we're really evolving. I know you've shown this through some of the work you've done over the years, and I think we're really headed towards that. So Matt, I'm gonna let you have the final word. Any final comments or thoughts for MD Insights as you think about innovation and technology in the future?
Absolutely, Miguel. Innovation is a team endeavor, and that includes physicians and caregivers across the organization. I'm looking forward to working with our team to develop many ideas to bring them to fruition along clinical service lines, education, access, and so forth. So looking forward to working with our fantastic team and bringing more innovation to our patients for better care.
Great. So with that, from MD Insights, from DDSI, Dr. Matt Kroh, thanks again, Matt, for your time and spending your knowledge with us in terms of some of the future of innovation and technology. Hope everybody enjoyed this, and have a good day.